Hi everyone. We have now learned in detail about the anatomy of external ear, middle ear and inner ear. We also learned about the physiology of hearing as well as equilibrium. So it's high time you learn about the diseases of middle ear cleft. And I'll be starting with the disease of eustachian tube because the parts of middle ear cleft includes eustachian tube, middle ear and the mastoid. Chronic otitis media will be dealt with in a subsequent session followed by complications of otitis media. But for now, we will be restricting ourselves to more of the acute conditions of middle ear cleft. And so we will start with the eustachian tube. What did I tell you about the functions of eustachian tube are? The functions of eustachian tube include protection, ventilation as well as drainage. Now, eustachian tube is actually protecting the middle ear from the nasopharyngeal secretions as well as the loud sounds coming from the nasopharynx while chewing. Okay, that is by remaining closed. Okay, it is acting like a valve, and ventilation function happens when the eustachian tube is open while chewing, and drainage also occur when it gets open. Okay. So, what is the main function of eustachian tube? It is ventilation, and the ventilation of the middle ear when it gets impaired, it can result in a lot of consequences, and that will be dealt with in detail today. For now, just remember that ventilation is the most important function of the eustachian tube, and the eustachian tube has got more chance to become dysfunctional in case of a infant eustachian tube. Why? Because the infant eustachian tube is wider, shorter and is having an angulation of only 10 degree, whereas in adults it is about 45 degree. So there is more chance for nasopharyngeal regurgitation to take place. Okay, so the disorders of middle ear cleft and in the eustachian tube dysfunction is more common in infants. Now, how is this eustachian tube functioning? It is with the help of the muscles tensor veri palatini and the lever pictor veri palatini. It helps in opening of the eustachian tube, and when it opens, the ventilation of the middle ear happens. Okay. Now, what are the methods to assess the function of the middle ear? You can assess the patency of the middle ear by doing certain tests like Valsalva maneuver, where you are asking the patient to pinch the nose and then to blow and to look for if the patient's middle ear is bulging outside by using an otoscope. And another thing that you can ask is to pinch the nose and swallow, and we can look for if the tympanic membrane is going inward. That's what is called Toynbee's maneuver. So Valsalva's and Toynbee's maneuver can be done, and apart from that, what else can be done? You can do a catheterization. Eustachian tube catheterization is one thing that you can do. How is that being done? You can use a eustachian tube catheter for that. Nowadays, eustachian tube catheter is more of use for removal of nasal foreign body. Okay, this is not at all done because this is a traumatic procedure. What you are doing is you are actually inserting a eustachian tube catheter which is metallic. It is inserted into the floor of the nose, and until the posterior end of septum is reached, it is inserted, and then it is turned medially up to the posterior end of the septum 90 degrees, and then you are engaging it in that area, and then it is turned 180 degree so as to put it within the eustachian tube orifice. And after it is cannulating the eustachian tube orifice, you are doing the insertion of the polyter bag, and then you are actually deflating the polyter bag so as to cause a sound within the middle ear. If you are auscultating with a stethoscope, you will be able to hear that sound. Okay, or an auscultation tube can be used, and so if the eustachian tube is patent, you will be able to hear that sound. Okay, so that is called eustachian tube catheterization. This is what is called a polyter bag. This is being connected to the eustachian tube for that, or you can directly insert into the nose and pinch the opposite nostril, and then ask the patient to swallow or make the sound K K, and the patient can the doctor can look at the middle ear, or he can auscultate the ear and look for the sound of the Pulitzer bag. Okay, all these are done to assess the patency of the eustachian tube. Apart from that, to assess the function of the eustachian tube, there are certain tests that are being done. That is the methylene blue test and the Saccharine test. These are done when there is a pre-existing perforation present. Okay, how is it being done? Here, through the perforation, methylene blue or Saccharine is introduced, and we are looking for whether it is reaching the nasopharynx. Okay, methylene blue, the color of the dye will be seen, and the Saccharine test also you will be able to appreciate the change in sweetness. Okay, now what happens if the eustachian tube is not functioning properly due to some reason? For example, a patelless eustachian tube, the Osman's pad of fat will be absent. So what happens is that it will be remaining open, it won't be getting closed, it will be remaining open. So the unwanted sounds will reach the middle ear, and that is why the patient will be having a notophony. Now when will this patelless eustachian tube happen? When there is a sudden weight loss. For example, Christian Bale, he underwent a sudden weight loss for acting in Machinist, right? And when you are pregnant also, there is high chance, and if there are diseases like multiple sclerosis, there is a high chance of this patelless eustachian tube. Okay, now in patelless eustachian tube, what is happening? There is autophony as well as the breathing sounds also will be heard because of the eustachian tube being open all the time. Okay, now how will you treat this condition? The eustachian tube is not functioning properly, right? So what else can we do to make it closed? The patelless eustachian tube should not remain open like this. One thing you can do is potassium iodide solution can be given, then estrogen nasal drops can be given, then weight gain will help. Okay, these are certain techniques to help with patelless eustachian tube. Okay, and the function of the middle ear, if it is severely affected, then you will even have to put a ventilation tube. Okay, so this is about a patelless eustachian tube. Now instead of the eustachian tube remaining open, if it is getting closed due to some functional problem or due to some obstructive cause, okay, then what will happen? If it is getting blocked due to an obstructive cause, there will be decrease in the ventilation of the middle ear, and that can result in negative middle ear pressure, right? And because of the negative middle ear pressure, what can happen? It can result in retraction of the tympanic membrane. Now the tympanic membrane has got two parts, right? The pars tensa as well as pars flaccida. Both of them can get retracted, but it is the pars tensa which gets retracted initially. And how is this pars tensa getting retracted? What are the signs of pars tensa retraction? There will be apparent foreshortening of the handle of malleus. That is, the handle of malleus will appear to be shortened even though it is not shortened, and the lenticular process becomes more prominent like this, and the cone of light will get distorted. Cone of light will be present. Then there will be sickling present. The pars tensa folds, the tympanomalleolar folds will undergo sickling. Okay, and even the ingulostapedial joint becomes more and more prominent. Okay, so these are the various things to look for when you are suspecting a eustachian tube dysfunction in a patient. Okay, now this is another picture showing a pars tensa retraction. Okay, now with severe retraction, what can happen? It can result in a atelectasis, and finally an adhesive otitis media. What is atelectasis? When the pars tensa goes on to touch the promontory, that is what is called atelectasis. And adhesive otitis media means it is completely plastered on the promontory. In atelectasis, it is temporarily touching the promontory, it can be brought back. Okay, whereas in the case of adhesive otitis media, it is completely plastered onto the promontory, as you can see in the figure. In this figure, this is the adhesive otitis media, this is the atelectatic otitis media. Now this staging is what is known as the SAIDS classification. Now what is the SAIDS classification? According to the SAIDS classification, the retraction of pars tensa can be divided into 4. Okay, that is, you can see the pars tensa here. This pars tensa, when it gets retracted initially, it won't be touching the long process of ingus. When it goes on to touch the long process of ingus, which is seen here, okay, when it goes on to touch the long process of ingus, then that is the stage 2. In stage 3, what is happening? It is going on to touch the promontory, but with Siegeleization and Valsalva maneuver, it can come back. That is what is called as the atelectatic TM, and in adhesive otitis media, it won't come back. Okay, so this is how it is seen. This is the pars tensa. It goes on to touch the long process of ingus in stage 2. In stage 3, it goes on to touch the promontory, and in stage 4, it can't revert back, and that is what is called the adhesive otitis media. So stage 3 is atelectatic TM and stage 4 is adhesive otitis media, right? So eustachian tube blockage is the event which precedes the retraction of TM. Along with the retraction of TM, what else can happen? Initially there is negative pressure building up, and following the negative pressure there could be transudation of fluid occurring from the vessels, okay, in the mid layer, and that is what is resulting in otitis media with effusion, or the serous otitis media. Okay, so the next topic is serous otitis media or otitis media with effusion. And what are the causes? Why does it occur? It is due to the obstruction of the eustachian tube orifice it is occurring. And in children, the most common cause is adenoids. Adenoids are seen in the nasopharynx in the midline, and it can go on to block bilateral eustachian tube orifice and can result in bilateral serous otitis media. Now this is the typical adenoid facies that you can see here, and in this case you can see that the child is having an open mouth with pinched in nostrils, and yes, adenoids along with cleft palate. Cleft palate is another cause of this eustachian tube dysfunction. Because of the cleft palate, the muscles will be inserted not in a proper manner, and that can result in a eustachian tube dysfunction. Now another reason why a serous otitis media can occur is not due to the decreased drainage. What else can be the cause? It could be due to an increased secretion of transudate, and that is seen in allergy. As you can see here, allergy can also cause serous otitis media. So serous otitis media can be due to either the blockage of the eustachian tube orifice, and because of that the drainage of secretions from the mid layer is getting obstructed, and that can result in this serous otitis media. That is one reason. And apart from that, what else can be the reason? It could be due to a cleft palate where the functioning of the eustachian tube is not occurring, or due to increased secretion as in allergy. Okay, when it is seen in an adult, it usually presents with a unilateral OME in adult, and when you see a case of unilateral otitis media with effusion in adult, you will have to immediately suspect a condition. What is that? It is nasopharyngeal malignancy. Okay, nasopharynx cancer has to be suspected. Okay, now what is happening in case of this otitis media with effusion? Slowly, because of the negative pressure, there is a build-up occurring. What kind of build-up? The transudate is getting filled in the mid layer. Okay, and this fluid slowly fills the whole of the middle ear, and because of that, what happens, the patient won't be able to hear properly, okay, because of the obstruction. Now in case of an infection which ascends up into the middle ear, the pressure can be so high because it is occurring acutely, unlike the otitis media with effusion which can become chronic. Acute otitis media occurs due to infection, due to the ascent of the infection into the middle ear, and that can result in the fluid coming out, that is manifesting as pus coming out. Okay, so in otitis media with effusion, applying the same principle, we can actually bring out the fluid. And how is this being done? This is by putting a nick in the tympanic membrane. Now what are the features of a otitis media with effusion? OME features include, yes, what are the features that you see here? There could be a dull and lusterless TM, okay, and apart from that you will be able to see bubbles, air fluid level may be seen, okay. All these are features of otitis media with effusion, and the mobility of the TM will be affected. And how will you confirm the diagnosis? For the confirmation of diagnosis, we do a test. What is that? The test for confirmation of diagnosis is tympanometry. Okay, on doing tympanometry, you will find that there is a B curve. Okay, there will be a B curve seen in case of otitis media with effusion. Now, what is the treatment of this condition? I told you, you can bring an opening on by yourself instead of allowing the patient to develop an opening due to the increasing pressure as seen in acute otitis media. In OME, it is not seen. OME usually there is build-up of pressure within in a slow manner, and because of that, the tympanic membrane slowly bulges out, but it do not perforate. Okay, and in OME, what you can do is you can use a myringotome. Okay, a myringotome is used to put an incision in the anteroinferior part of the tympanic membrane. Okay, in the anteroinferior part, you put a radial incision like this, and you drain the fluid out. Okay, and after that, what you can do is you can put a ventilation tube or grommet. Okay, a ventilation tube or grommet is put in the anteroinferior part, and it actually is doing the function of the eustachian tube. This grommet will do the function of the eustachian tube, that is ventilation of the middle ear. Okay, so this is how a otitis media with effusion is treated. Now, how do you diagnose a case of otitis media with effusion? I told you the patient will come with complaints of ear blockage. Okay, and many a times the patient will have allergic symptoms, and apart from that, there will be decreased hearing. In case of child, he could present with an inattentiveness in the school because of the decreased hearing. The child will go more and more in front of the TV according to the parents, so as to hear the sound. Okay, and there will be delay in speech development because of the hearing loss. About 40 to 45 decibel hearing loss can occur because of the otitis media with effusion. Okay, so that is significant enough to cause a speech delay. So all these can be the presentation of the otitis media with effusion, and on examination there will be dull lusterless tympanic membrane. Now on doing a tuning for test, what are the features seen in case of otitis media with effusion?